Hello to all, myself Dr. Tabish Fahim, and today I am going to present about joint classification. In human body we have different types of joints. Some are simple joints and some are complex joints. Simple joints are basically responsible for providing stability and complex joints are mainly responsible for providing the mobility. However, most of the joints in the human body have to serve both mobility and stability function and must also provide dynamic. Joints designed primarily for human mobility are called synovial joints. These joints are constructed so that the ends of the bony components are covered by hyaline cartilage and enclosed in a synovial sheath called joint capsule. In synovial joint we can find wedges of cartilage called menisci, disc, plate, labra. These things provide the stability by increasing the surface area of the synovial joints, and it also helps in providing the shock absorption and to facilitate motion. In addition, we have lubricating fluid in our synovial joint which is secreted at all synovial joints to help reducing the friction between these articulating surfaces. In the traditional method of joint classification, the joints of the human body are divided into two broad categories on the basis of the type of materials and the methods used to unite the bony components. Subdivisions of joint categories are based on material used, the shape of the contours of the articulating surfaces, and the type of motion allowed. The two broad categories of arthrosis are synarthrosis, that is non-synovial joint, and diarthrosis, that is synovial joint. Talking about the structural classification of the joints, we have fibrous joint, cartilaginous joint, and synovial joint. These fibrous joint and cartilaginous joints are the part of non-synovial joint. Under fibrous joints, we have again subclassifications, that is sutures, gomphosis, and syndesmosis. Under cartilaginous, we have primary and secondary, that is syndesmosis and synchondrosis joint. Under synovial joint, we have plain synovial, hinge, pivot, condylar, saddle, ball and socket joint. Now, synarthrosis joint. The material used to connect the bony components in the synarthrodal joint is interosseous connective tissue, that is fibrous or cartilaginous. Synarthrosis are grouped into two divisions according to the type of connective tissue used in the union of bone to bone, that is fibrous joints, and the cartilaginous joints. The connective tissue directly unites one bone to another, creating a bone-solid connective tissue-bone interface. Means in synarthrosis joint, the chances of mobility are very less because of the directly connection of the bone to bone. A fibrous joint is the joint where the bones are bound by a tough fibrous tissue. These are typically joints that require strength and stability over range of movement. The types of fibrous joints are sutures, gomphosis, and syndesmosis. Talking about suture joint, a suture is one in which two bony components are united by a collagenous suture ligaments or membrane. The ends of the bony components are shaped so that the edges interlock or overlap over one another. This type of joint is usually found in a skull, and early in life it allows a small movement. Fusion of the two opposing bones in suture joints occur later in life and leads to the formation of bony union called as synostosis. Basically in suture joint there is limited movement which is until the age of 20 years, after which they become fixed and immobile. They are most important in birth, as at that stage the joints are not fused, allowing deformation of the skull as it passes through the birth canal. A gomphosis joint is a joint in which the surface of bony components are adapted to each other like a peg in a hole. In this type of joint, the component parts are connected by fibrous tissue. The example of gomphosis joint is the joint between tooth and either mandible or maxilla. You can see here this image. A syndesmosis is a type of fibrous joint in which two bony components are joined directly by an interosseous ligament, a fibrous cord, or an aponeurotic membrane. These joints usually allow a small amount of motion. Example is between the shaft you can see the shaft of tibia and fibula here, and the shaft of the ulna and radius. In between these two bones, you can see the ligament which is present here. This is the interosseous ligament, and these are the example of the syndesmosis joint. Coming to cartilaginous joint, the materials used to connect the bony components in cartilaginous joints are fibrocartilage or hyaline cartilage. These materials are used to directly unite one bony surface to another, creating a bone-cartilage-bone interface. It means between two bones there will be a cartilage. The two types of cartilaginous joints are symphysis and synchondrosis. Symphysis joints are also termed as primary joints, and synchondrosis joints are termed as secondary joint. Example of symphysis joint include the intervertebral joints between the bodies of the vertebra, the joint between the manubrium and the sternal body, and the pubis symphysis. Here you can see the pubis symphysis joint and the joint between the two bodies of the vertebra. Synchondrosis joint is basically a type of joint in which the materials used for connecting the two components is hyaline cartilage. The function of this type of joint is to permit bone growth while also providing stability and allowing a small amount of mobility. Some of these joints are found in the skull and in some other areas of the body at the site of bone growth. Here you can see these blue things are the synchondrosis joint. Example can be the first rib with the sternum, the attachment of the first rib with the sternum. Coming to diathesis. Diathesis is basically synovial joint in which the ends of the bony components are free to move in relation to one another because no connective tissue directly connects adjacent bony surfaces. The bony components are indirectly connected to one another by means of a joint capsule that encloses the joint. Synovial joint may be associated with accessory structures such as fibrocartilaginous disc, plates or menisci, labra or fat, pads and ligaments and tendons. Now the features of synovial membrane. A joint capsule is there which is composed of two layers. A joint cavity that is enclosed by two joint capsule. Synovial tissue that lines the inner surface of the capsule. Synovial fluid that forms a film over the joint surfaces. This synovial fluid is basically responsible for providing the mobility between their two joints, or simply you can say that it helps in reducing the friction between the two joints. Hyaline cartilage that covers the surface of the enclosed cartilaginous tissue or bones. Now the subclassification of synovial joint. Basically there are three types of classification, that is uniaxial, biaxial and triaxial. Uniaxial having one axis, biaxial 2, triaxial 3. Triaxial is also termed as multiaxial, means having 3 or more than 3 axes. A uniaxial is constructed so that the visible motion of the bony components is allowed in one plane around a single axis. The two types of uniaxial diacetyl joint found in human body are hinge joint and pivot joints. Here you can see the different types of synovial joints which are present in the human body. The pivot joint, hinge joint, saddle joint, plane joint, condyloid joint and the ball and socket joint. We will explain each and every joint in detail now. Hinge joint. A hinge joint is a type of joint that resembles a door hinge, means having one axis and one plane, means the motion normally happens in single axis only. Examples are interphalangeal joints of the finger. It can be for the upper limb and it can be for the lower limb also. Pivot joint is a type of joint constructed so that one component is shaped like a ring and the other component is shaped so that it can rotate within the ring. Here you can see the image. This part is formed like a ring in which this part is going to move, or you can say that this part is going to pivot. Here in skull also you can see atlantoaxial joint. In this, atlas is going to attach with axis. This is also a part. This is also a type of pivot joint. Biaxial diacetyl joint are joints in which the bony components are free to move in two planes around two axes. Therefore, these joints have 2 degrees of freedom. In uniaxial, we have 1 degree of freedom. There are 2 types of biaxial joints in the human body, that is condylite and saddle joint. Condylar joints are shaped so that concave surface of one bony component is allowed to slide over the convex surface of another component in 2 directions. Example is your metacarpophalangeal joint. Here you can see the metacarpophalangeal joint. One surface is concave and another surface is convex here. A saddle joint is a joint in which each joint surface is both convex in one plane and concave in other, and these surfaces fit together like a rider on a saddle. Example is your carpometacarpal joint. Here you can see the carpometacarpal thumb joint of the thumb. Now coming to triaxial joint. Triaxial joint is also termed as multiaxial diarthrodal joints, in which the bony components are free to move in 3 planes around 3 axes. These joints have 3 degrees of freedom. The 2 types of joint in this category are plane joints and ball and socket joint. Plane joints have a variety of surface configurations and permit gliding between 2 or more bones. Example here, carpal bones. Here you can see the joint between these different carpals are the plane joint. Ball and socket joint are formed by ball-like convex surface being fitted into a concave socket. Here you can see this part is concave and this glenoid cavity of the humerus is concave and this head of the humerus is convex. Here again you can see this fossa of the pelvis is concave and the head of the femur is convex. The motions permitted are flexion extension, adduction abduction, rotation and combination of these movements. That is, the example for this one is hip joint. Thank you so much.